There's a small habit seemingly harmless that's quietly putting thousands of older adults at risk every single day, right inside their own homes. And the sad truth is, most of us don't even realize it. Do you ever find yourself sitting on the toilet for more than 5 minutes? Have you ever felt dizzy, lightheaded, had a racing heart, or even felt nauseous after using the bathroom? If so, you're not alone. More than 70% of people over 60 still do this again and again without knowing it could lead to serious consequences. Sudden drops in blood pressure, fainting, and even stroke or cardiac arrest. Right then and there. My name is Dr. Sarah Bennett. In over 20 years working in major hospitals across the US, I've witnessed far too many heartbreaking cases where a patient was simply using the restroom and later found by a loved one unconscious, or worse, unresponsive. One case I'll never forget was Mr. Douglas, 74 years old, living alone. That morning, he woke up early, like always, and went to the bathroom at 6:15 a.m. But by nearly 7, his neighbor had been knocking with no answer. They broke in and found him collapsed next to the toilet. He had strained too hard while constipated, and a sudden lack of blood flow to his heart brought him down forever. I'm not sharing this to scare you. I want you to understand that sometimes it's the little things, the ones we don't think about, that can make the biggest difference for your health or even your life. In this video, I want to share with you the 5 most common mistakes older adults make while using the toilet. These habits quietly wear down your health, leaving you tired, in pain, and at risk for serious heart, brain, blood pressure, and digestive complications. And more importantly, I'll show you how to spot early warning signs from your own body, right there in the bathroom. Please stay until the end of the video because sometimes one small change could spare you a lifetime of regret. Habit number 1. Excessive straining. The silent killer in your bathroom. Many people believe straining is just part of going to the bathroom. But for older adults, it's more than a habit. It can become a silent killer. Imagine this. When you strain, you're pushing with all your strength to force pressure out of your belly. But it's not just your intestines that feel it, your whole abdomen, chest, and blood vessels are under pressure too. Straining increases pressure inside your belly and chest, which can stop blood from reaching your brain. The result? You might feel dizzy, blurred vision, ringing in your ears, or worse, pass out on the spot. Tiny strokes, irregular heart rhythms, they can all start right in the bathroom, a place we often think of as safe and private. I remember one case vividly. An 81-year-old man living alone in suburban New Jersey. He was healthy, just occasionally complained about mild constipation. One morning, he went into the bathroom as usual, but nearly an hour passed, and his longtime neighbor noticed something was off. The door was still shut, no sounds. They knocked and called out, but no answer. Emergency services had to break the door, and there he was, collapsed beside the toilet. No response. Thankfully, they reached him just in time, but the doctors confirmed he had fainted due to a sudden drop in blood pressure from straining too hard. Just a few minutes later, and he might not have made it. I'm not saying this to make you afraid. I'm saying this so you start paying attention to your own body, your own habits with care and with love. Are you forcing yourself to push too hard? Have you ever felt your heart pounding fast, or felt exhausted after trying to push out a bowel movement? There's something I often joke about with my older patients. If you have to push like you're trying to move a boulder out of your body, your heart is being squeezed just as hard. It's okay to use a bit of pressure, but if you have to strain every single time, that's not normal anymore. The most common reason is chronic constipation, and I'll talk more about how to fix that later in the video. But for now, I just want you to remember this. Never ignore that tired, drained feeling after using the bathroom. It could be the first signal of a deeper health issue silently building inside your body. And that is just the tip of the iceberg. Because next, I want to talk about another very common habitone that seems harmless, but is quietly damaging your rectal, nervous, and circulatory health. Habit number 2, sitting too long, the hidden cause of hemorrhoids and numbness. Now that we understand the dangers of excessive straining, let's look at another habitone that seems totally harmless, but is quietly damaging the health of so many older adults: sitting too long on the toilet. I know for many people, the bathroom is a private escape. A place where you bring the morning paper, your phone, maybe even a tabletto scroll, read the news, play a game, or look at pictures the grandkids sent from afar. Sounds reasonable, right? But when that turns into a daily habit, it quietly begins to attack the most sensitive areas in older adults, the rectum and pelvic floor. Did you know when you sit too long on the toilet, the entire weight of your upper body presses down on your pelvic area? The small, delicate veins in your anus and rectum get squeezed. This causes them to swell unnaturally. That's how hemorrhoids form. And if you keep sitting like this every day, those hemorrhoids won't just sit still. They'll start to drop down, causing pain, bleeding, even long-term infections. But that's not all. Sitting still for too long also affects the nerves in your pelvic floor. These nerves control your ability to feel the urge to go. When you sit too long, they get numbed, and you slowly lose the natural feeling of needing to poop. Some people end up depending on laxatives, enemas, or mechanical stimulation just to go. And the sad part is, once that natural signal is gone, it means your body has lost one of its most basic survival instincts. I once treated a woman named Martha, 78 years old. She lived with her husband, son, and 2 grandkids. Every morning, she'd take her phone into the bathroom to read the news and play a few little games to wake up. At first, it was 5 minutes, then 10, then 20. A year later, she came to see me with stage 3 prolapsed hemorrhoids, loss of anal sensation, and frequent leaking without even knowing it. She looked at me, smiled sadly, and said, "I thought I was just relaxing. I didn't know I was hurting myself." I understand. Sometimes you just want a quiet space away from the noise, the stress of family or life. But my friend, the toilet is not the place to stay long. I always tell my patients one simple rule. If you've been sitting for 5 minutes and still can't get up, walk a little, sip some warm water, take a deep breath and come back later. Don't sit and wait. Don't force it. Don't use the toilet as your inspiration corner. And more than any, create a steady rhythm for your body. Eat on time. Sleep enough, drink plenty of water, move a little every day. When your digestion is strong, you won't need to wait for the feeling. Your body will naturally remind you, gently and clearly. Next, I'll share something most people never think about, but it's so important: how to recognize your health signals from your own stool every day. When I was a young resident doctor, there was something my mentor once said that I'll never forget. If you want to know what's really going on inside a patient's body, ask about their poop. Sounds silly, doesn't it? But it's one of the most powerful truths. Stool, something most people ignore, or even find gross, is actually one of the clearest mirrors of your internal health. And the worrying thing is, so many older adults miss early warnings of disease just because they never look back after going. Have you ever noticed the color of your stool today? Is it soft or hard? Is there blood? Does it smell different? I know those questions might sound awkward, but they matter a lot. For example, if your stool is black like tar, it might be a sign of bleeding in the stomach or small intestine. If it has bright red blood, it could mean hemorrhoids or rectal injury. If you see pale, loose, foamy stoolet, could be malabsorption, colitis, or even early-stage cancer. I want to tell you about a former patient, Margaret, 69 years old, a simple woman living with her husband in the suburbs. One day, she came for a routine checkup. But during our chat, she mentioned that her stool had looked unusually pale lately and sometimes had bright red streaks. No pain, no discomfort. But because of that little detail, we decided to do a colonoscopy. And we found early-stage colorectal cancer, no spreading yet, no clear symptoms. She had surgery in time, and today, she's still healthy, enjoying life with her family. I still remember what she said to me when she left the hospital. Just because I looked back at the toilet every morning, I saved my life. You see, the bathroom isn't just a place to relieve yourself, it's where your body whispers to you about your health. All it takes is a few extra seconds a day to look, to observe, to listen. Don't be shy, don't brush it off, because many serious illnesses never arrive loudly. They start with tiny changes only, noticeable to those who pay attention. And if today, you notice anything strange in your stool, don't panic, but don't ignore it either. Keep track, watch for a few days, and talk to your doctor if needed. Your awareness today might be what helps you live longer, healthier, and more peacefully in the years ahead. Next, I'll talk about something many people do wrong every day, and it could lead to infections, burning pain, and even long-term damage to the anal area. You'll be surprised to learn that some habits that seem clean are actually harming you silently. Improper anal hygiene, a hidden cause of infections, fissures, and bacterial spread. We just talked about how your stool can send you important health signals. But there's something just as important that happens right after you goned. That's how you clean yourself. And unfortunately, many older adults are doing this the wrong way every single day, without even realizing it. I once asked a group of older patients during a consultation, "After you poop, which direction do you wipe?" Some said front to back, some said back to front, and others said, "I just wipe around until it feels clean." It might sound like a minor detail, but the way you wipe can actually determine whether you're cleaning properly or pushing bacteria right back into your body. The first mistake I often see is wiping from back to front, especially among women. This can accidentally drag bacteria from the anal area toward the urethra and vaginal area. For older adults, as the mucosal barrier weakens with age, this can lead to urinary tract infections, vaginal infections, or bladder infections, painful and often recurring. The second mistake is using too much dry toilet paper or wiping too hard. Dry paper can scratch and irritate the thin, delicate skin around the anus. Some people feel clean only when they scrub thoroughly, even until it stings, but what they're really doing is causing tiny injuries day after day. Over time, this can lead to anal fissures, dermatitis, itching, burning, and even bleeding after bowel movements. And the third mistake, often seen as modern, is using a bidet or spray hose with too much pressure. I once had a male patient, 67 years old, very neat and particular. He always used a spray hose after every bowel movement, but he liked the water strong and sprayed it directly inside the anus, saying it felt cool, clean, and refreshing. The result? Just a few months later, he started feeling pain when sitting, pain while straining. Upon examination, the anal area showed mild trauma, sensory disruption, and low-grade inflammation around the skin. So yes, too much clean can also become a problem. So, what's the right way to clean safely and effectively? Very simple. Wipe from front to back, especially important for women. Use soft toilet paper, or, if you can, fragrance-free wet wipes for gentle cleaning. If you use a bidet or spray, make sure the water pressure is low. Aim at an angle knot directly inside and don't spray for too long. Then pat dry gently with a soft cloth. Never leave the area damp for too long. For sensitive skin, you can apply a thin layer of fragrance-free, chemical-free soothing cream to protect that delicate area. And if you notice any persistent itching, pain, or burning, don't hesitate to see your doctor. Remember, proper hygiene brings comfort, but poor hygiene, even when well-intentioned, can become a silent burden on your body. Coming up next, I'll share one of the biggest reasons why going to the bathroom feels hard and exhausting for many people. It's not enough water and fiber. If you're often constipated, sitting too long, or straining hard, stay with me. This next part will give you gentle, natural, and effective ways to improve your digestion day by day. Not getting enough water and fiber, turning bathroom time into a struggle. After we fix the way we clean ourselves, there's another essential factor, and it's truly the foundation of everything that happens in the bathroom: your daily diet. More specifically, whether you're getting enough water and fiber. I once asked an older patient of mine, "How much water do you drink each day?" He smiled and said, "Well, I don't really feel thirsty. I just sip a little with meals. If I drink too much, I end up peeing all day." That answer is all too familiar, and I believe many of you watching this video are probably thinking the same thing. But let me tell you, our body, especially after 60, are prone to chronic dehydration, even without clear signs. When you don't get enough water, your stool becomes dry and hard, your intestines work harder, and the result is straining, long bathroom time, pain, and a vicious cycle that never seems to end. It's not just water, we're also missing fiber. It's something older bodies really need, but we often forget about it. Fiber is like a soft broom. It helps sweep out the intestines, shape your stool, keep it moist, and help it move along smoothly. Without enough fiber, your stool can either be too loose and unformed or the opposite, dry and clay-like, making every bathroom trip feel like a battle. Some people think just eating vegetables is enough fiber, but not all vegetables work the same. What you need are fiber-rich fruits and veggies with soluble fiber like ripe papaya, bananas, avocado, oats, chia seeds, boiled sweet potatoes, spinach, amaranth, or apples with the skin. These are easy to add to your breakfast or daily snacks. As for water, don't wait until you're thirsty. I always tell my patients to space out their water intake throughout the day. For example, a glass of warm water right after waking up, one after breakfast, one mid-morning, one after lunch, one mid-afternoon, and one small glass in the early evening. That's just 6-7 small glasses a day, enough to soften your stool and help your intestines move without making you wake up to pee all night. I also recommend a simple morning ritual, just a bit of light movement like walking around the house, stretching, or gently massaging your belly clockwise. These little habits, when done every day, will help your digestion work better, and you'll feel lighter, more comfortable when you go. You know, there are things we can't change, like our age, our wrinkles, or having to take medication every day. But there are things we can control, like what we eat, how we care for our bodies each morning. We may not be able to turn back the clock, but we can help our bodies feel lighter, stronger, starting with small actions, like a warm glass of water and a slice of ripe papaya in the morning. So now we've walked through 5 common but important mistakes that many older adults make every day in the bathroom. From straining too hard, sitting too long, improper cleaning, to forgetting water and fiber, these may seem like little things, but they directly affect your health, comfort, and even how long you live. I know sometimes we think, "I've lived like this all my life, it's too late to change now." But I want you to know it's never too late to start caring for your body again. You don't have to make big changes. Just start today by listening to your body a little more, checking after you go, drinking one more glass of water, choosing your breakfast a bit more carefully, adjusting how you sit, how you clean. Your body will feel it, and you'll feel it too. Your mornings won't feel like a struggle. Your afternoons won't be filled with fear of hemorrhoids, constipation, or pain. And your nights you'll sleep better, because you know you're taking care of yourself the right way. I've met many people who once feared every trip to the bathroom, but then they made small changes, and everything got easier, more comfortable. And the amazing thing is, they started feeling better from those little things. If you found this video helpful, please share it with your loved ones, especially those who live with elderly parents, or if you yourself are stepping into your 60s or 70s. Sometimes, one timely reminder can change the course of someone's life. And don't forget to hit that subscribe button so I can keep sharing with you more gentle, calm, and meaningful health tips for aging well. I'm Dr. Sarah Bennett. Thank you for staying with me until the end of this video. I'll see you next time.